So I'm Simon Bull. I'm the Chief Executive of CMT UK, and it's nice to meet you. Lovely to meet you.
Lovely to meet you as well.
And you are?
Yeah, my name is Andrea Cortese. I'm a neurologist and a scientist from Italy originally, but working in the UK, in London, and in Italy as well. I keep doing some work and teaching in my former university, University of Pavia, some really across the European Union and bridging to the UK. So it's a perfect position for this type of meeting where we want the UK still very much, I think, involved in this European initiative and federation.
Yes, and we still want to be involved very much. So how is your work related to CMT, your day-to-day work?
Yeah, well, my work in CMT started about 8 years ago, and it's interesting that at some point they also the issue of how should we name it came up. I think CMT is a good way to refer to it. Is the mostly used, but it's true that there are hereditary neuropathies in general. Yes. So it's patient with neuromuscular condition, sometimes with a genetic cause, sometimes still looking for it. And my experience in the field of hereditary neuropathy started off with another hereditary neuropathy, which is amyloid neuropathy, which is also hereditary. So I developed my interest in this type of disease, hereditary disease, in this type of patients who are actually pretty affected and disabled over the years. And I tried to, and I developed my commitment. So in my day-to-day work, I'm very much involved with the genetic side of CMT, so identifying novel causes of CMT for those patients that are still, genetically unconfirmed. And we know that finding the cause and the gene responsible for the disease is really the first step towards treatment, which is all what patients and us want. And then I moved to the UK. And I started really working in CMT, Queen Square, together with Professor Riley and Professor Stefan Zuckner, because we spent some time in the US. So I had an exposure to the two systems, the European UK one and the American one. And I see that, this is a European conference, but we all want to work all very much together, although trying also to build up a European community in CMT. So basically I started off working in London about 7-8 years ago, and I'm still there. And now the good thing is that from sometimes people say, okay, new causes of new gene, how relevant, but I think it is very relevant. So what we're doing in terms of finding genetic causes of CMT is very relevant, and I think we had the experience of one gene which I was involved in the identification, which is SORD, which is now really the first trial and the first hopefully treatable form of CMT. So it's been a very rapid, accelerated journey towards treatment, and I think is what we all want here and what patients want. So
absolutely, yes. And have you? When you saw the invite to this conference, was it a no-brainer? You had to be here, or was it?
I was very keen. I was very keen to see this initiative coming. I was too keen because when I received the invitation 2 years ago, one year and a half, I thought it was already happening. Well, I realized that it needed preparation, and finally we met this year in 2023. And I think it's a great initiative because I think we should be more together. So us, clinicians across Europe, I think there's already excellent networks of collaboration, also at personal level, between clinicians working in the CMT field. We get along well, and I think that's the basis of a successful output in the CMT field on various levels, not only genetics, but also natural history studies, outcome measure. We need to work together. But I think the added value of this conference is to bring together patients' association at European level and try to build a community which will make the European CMT community, including patients, healthcare professionals, scientists, together to be stronger and to get more, to do more on this disease at European level.
So there's already a lot of collaboration going on, but this is an improvement to that, an extra step, a kind of a...
Totally. I think, working well together is a good starting point. But I do think also that, we can and we must do much more for the CMT patients. And I think that doing it in our single-owned countries can lead to some successful outputs. But I think that doing it at European level will bring it to a different level. I think it would be of great use for the CMT community, including the UK, because as I said, we really want the UK to be part of this.
We're all the same family, yes, absolutely.
Indeed.
Yes. So, and how have you found the conference?
The conference has been excellent. I liked the general outline. I liked the interaction at various levels between patients, healthcare professionals, and different stakeholders that have an interest in CMT. So I think I was particularly involved in a workshop on patient registries. I think that's been a very useful discussion to make see where we are. A lot has been done, but again, because of pass me the word fragmentation, I think so many registries are out there. Yeah. There's no way they can easily talk to each other, and I think from the patient registry perspective, this European initiative could really be a game changer, because of course there are hurdles. There's data protection issues. There's intellectual property in terms of also acknowledging the work of different people and groups, and it's been brought up also that young people are sometimes the driving force, and they need to be acknowledged as far as the work is related. And but I do think that the trying to address these issues at European level with the help of the European community itself, bringing up what are the unmet needs of CMT is what we really need at this stage.
So if we can overcome the issues, as you say, the GDPR type issues, and put together a European registry is a natural step, is an obvious step, if you like.
Well, it's an ideal step. An ideal step would be a unique registry, a European registry, perfect, a European registry which can talk with other international registries. That would be, even a more ideal scenario where, patients, because really we realize in genetics that a lot of information comes out from the comparison of patients in different countries, and the genetics of the disease in one particular country and the genetics of the population of the country can really help us to understand the disease in another ethnicity. And we realize only now that there's been examples of patients and families which were thought to have a particular mutation in a gene, and then when you include more populations, and that's why the European effort is great, the global effort even better, they realize that that particular variant in the DNA, we'll all have plenty of variants, it's very common in another population, so really help to discard the variant. So I think from the genetic perspective, something that I'm particularly interested in, I think having a good representation of different countries, different ethnicities living in those countries is really needed to take forward the genetics of CMT and treatment.
So after these 2 days here in Paris, what are you taking home from the conference? What are your...
Well, I'm taking home definitely increased motivation. For sure, increased motivation in carry on doing what I'm doing, some good ideas in terms of how we can improve our research, the care of our patients, also learning from what has been done and is being done in other countries. So I think, and also it was really nice to meet the different representative of patient association. There are many around. And they all work towards the same goal. And I think a coordinated effort with everyone's input and participation would be actually great.
Okay, well, thank you very much for answering my questions.
And thank you.